Anyone suffering from chronic pain knows what an impact it can have on their entire life. And some people think they are out of options when it comes to treating that pain. But something you may want to learn more about is prolotherapy. Dr. Timothy Special is a prolotherapist at Caring Medical Center, and we are happy to have him back on the show. Good morning, doctor.
Yeah, thanks, Carly. Thanks for having me.
Yeah, so again, I'm always excited to tell people about this relatively new, not new to you, but kind of think new to Southwest Florida, prolotherapy. And this morning we're going to talk about how it may be able to help with our hips, which is another kind of common injury and source of pain for people, isn't it?
Well, what happens, Carly, a lot of people, and they're saying, they come in, gee, doctor, I didn't, how come I'm bad right now? How come I have this pain right now? What probably has been going on, unless you had just an acute injury, that doesn't happen a lot with hips. It does. But
think of a fall. Sometimes when you're older and you can maybe hurt your hip there.
But they might even have started with, they started compensating because of their back problem. And a lot of people don't realize that they may have some backs that might be referring to the hip, or the hip might be referring to the knee. So they have to go to someone like a prolotherapist or a non-surgical orthopedic physician, I'm an osteopathic physician, to diagnose. And what happens is these, our body's made up of ligaments, okay, and tendons and muscles. And these ligaments start getting weak and stretch from maybe repetitive injuries or an injury that never had a really complete healing. And they say, so a lot of people just kind of deal with it. I had a really good picture I showed my office. We're in a state of okayness, but we're not really well. We want to, we should be in the thrive zone, okay? And my professor, Dr. Smith, I did a functional medicine fellowship. She said, do we want to live to be 100 years old, but going to a nursing home at age 80? Absolutely not.
No.
Okay, we want to be healthy. We want to see our grandkids. So, you know,
and great grandkids.
Sure, and you know, and there's a there's some wonderful orthopedic surgeons, specialists that do hips, and I'm grateful. I send them to them. But many people don't need to have hip surgery.
Yeah, well, and let's look at the hip real quick and talk about, so people can kind of visually see. And now you have this great app that you wanted to tell people about too, that you're able to use in the office.
This is from, it's called Essential Anatomy 3, and it's three-dimensional, Carly, and you can see this here. This is a picture of the pelvis and the hip joint. The white area is
that real white area.
Real white is the ligament, and what happens, they get stretched like rubber bands, and if they get stretched, they don't have good blood supply, and what happens, then you get a wear and tear of the joint. And that's what happens. But this app is three-dimensional. I can show the muscles, tendons. I show where I inject it and to repair it.
Well, and talk about what prolotherapy is. I love that you guys are so passionate about really educating people who come in, certainly on our show as well. So you're able to use that app to kind of explain the anatomy. But explain what prolotherapy is and how it is able to be another option for people and getting rid of that pain.
Well, prolotherapy is exciting. You might say, Dr. Special, how can I be excited 25 years later doing this? Because it works. Yeah. And I'm a patient, and I've had almost every, I'm a prolo junkie. So I've had almost, so is Dr. House, we all are. We take care of each other. But we've had, because your hips get unstable, like every other joint in the body, and we can inject them with irritants like dextrose, which is a natural substance, and if that doesn't work, we have platelets. It's called platelet-rich plasma. You might have heard of Heinz Ward, the athlete. That's where it started with the athletic injuries.
Okay.
And then even Peyton Manning had stem cells, and we do that in our office too. We either take fat.
And it's from your own body?
Your own body, and you do it right in the office. It doesn't have to go anywhere. It takes an hour or so. Or we take bone marrow stem cell, and we re-inject in the body, and the body recognizes how you have an injury, but you haven't healed. So we're giving you good growth factors. Yeah. And we put those growth factors in, and the body recognizes it and say, wow, okay, and the body can be significantly improved. Most people, Carly, we say anywhere from 4 to 6 visits. There's slow healers, there's fast healers, there's medium healers. But people go right back to work. Wow. They're sore for 2 or 3 days.
And if someone's looking at surgery or maybe having to consider that, I can see why this may be a step to look at too.
This is, you know, joints can work great, but I just had a gentleman this past week. He's had 2 total joints, and you know, it's very difficult for us now, and they failed. He's still having pain, he's unstable, and he said, what do I do, doctor? And it's difficult.
Well, and I love that your team there, you and Dr. Hauser and certainly your staff there, it's about the big picture. It's not only prolotherapy, but you will really take time with people and talk with them and figure out what's going on. This isn't an easy 1, 2, 3, okay, here's what we're going to do.
No, it's not like you flip up an MRI. Yeah. Carly, there's a saying, people don't care how much you know till they know how much you care. And we're called Caring Medical, so do we care? Absolutely, because everyone's an individual, and you'll see we don't run a mill in our office. We take our time. We want a lady or gentleman to come back. They want to play with their grandkids again. They want to play with their kids, the factory worker, the carpenter, the guy building a pool, they're just as important as a famous athlete.
Yeah.
They want a quality of life.
Amen. I love that.
Absolutely.
Well, and I love how passionate you are about it. Again, you really want people to come and meet you for a consultation.
Absolutely.
That's the best thing to do to find out if you are a candidate for this?
Sure, you can come back and we'll tell you the truth. You can go to our website at caringmedical.com. We have a great staff. Everyone is, the neat thing about our staff, Carly, is that everyone is a patient.
Yeah.
Because everyone understands, they've all had injuries themselves and they understand prolotherapy.
Dr. Special, thank you so much for being here. We love to have your team here, and we look forward to having you back next time.
Thanks a lot, Carly.
Certainly for Warren Caring Medical Center, all you have to do is head to our website, fox4morningblend.com.